Today we will be talking about one of the CTO balloons, the Nic Nano Hydro, which is a new addition to our armamentarium to treating CTO lesions. Now, once you have crossed with the wire in a CTO, the next big task is to cross with the balloon. And there are cases where we have crossed with the wire but failed to cross with the balloon, and in spite of the great achievement of getting the wire through, if you can't get the balloon through, all your efforts to get the wire through are wasted. So once you get a wire through, you have to get the balloon through to dilate the lesion. So in this scenario, what are the properties that are required of a CTO balloon? So it has to have an extremely small size tip. So the crossing profile, that means the entry crossing profile of Nic Nano is 0.016, which is marginally more than the guide wire. Now once the profile wise the tip can enter, which is very snug on the wire, the tip also has to be tapered. So Nic Nano provides this tapered tip which can make its entry or have some kind of pushability through the lesion. Now once you cross with the tip, the next issue is the balloon profile. So even if the tip has a low profile, but if your balloon does not have a very low profile, then even though the tip will enter, but the rest of the balloon will not enter very easily. So what Nic Nano provides is a low profile. So one, as an expanded version, it's a 0.85 millimeter balloon, but the crossing profile of the balloon, the deflated balloon, is only 0.019, which is extremely low. But apart from this, it has two other advantages, and that is that it has only a proximal marker. Now as you know, that marker, this wedged marker, increases the balloon profile to some extent and makes it more difficult to cross. So because you have only a proximal marker, so the balloon would have already crossed by the time the proximal marker comes to the entry point of the lesion. So your marker does not sort of take away the advantage of the crossing profile of the balloon. Apart from that, it is essential that the balloon should be able to sort of glide through this occlusion, because if the surface is not good enough, then it will we have to use just blunt force. So in order that it kind of glides through, it needs a hydro coating, which is also provided by the Nic Nano balloon. So you have all these advantages of a very small tip, the tapered tip, the low crossing entry profile, low crossing profile of the balloon because of the proximal marker, and 0.019 deflated balloon profile. And in addition, you have a very kind of robust hub which helps you in handling the balloon, and it provides a better pushability to the balloon. So with these advantages, in those situations where you're crossed with the wire and you're finding it difficult to get your usual balloon through, the Nic Nano can majority of the times will be able to get through this total occlusion, and you can then create a small channel with this. It also sustains high pressure, that means the rated burst pressure is about 20. So because once you have crossed, you also need to adequately dilate the lesion. CTO lesions are very difficult to yield, so you need the balloon which can sustain high pressure. So this will also help you in sustaining high pressure. So once you have inflated with Nic Nano, you will create a channel approximately of something like about a millimeter or so, and then you can get your any other balloon which is 2 millimeter, 2.5 millimeter, whatever, across the CTO, and then gradually dilate the lesion and then maybe use any other techniques to get adequate result. So Nic Nano is a great addition to the armamentarium of treating CTO lesions, and it kind of reduces your failure rates after having crossed the wire through the CTO. Thank you.